Hi, this is Dr. Chan here at Dentistry. We've been getting a lot of questions about dental x-rays. So today we're going to talk about that topic and see if we can bring some clarity to the topic of diagnostic procedures during dental exams. What are x-rays? Why do we need them? So dental x-rays are just one of the many tools that we use to help us figure out what's going on in your mouth and your body, see if things are healthy or not, and see if we can do anything to help make you as the patient healthier and better. So one of the first things that we might do is just look at things with the naked eye. Just do an exam, both inside the mouth and outside the mouth. Another thing that we might do is take dental x-rays. Dental x-rays are something that we use. It's an imaging procedure that we do to basically see what's going on underneath the skin and into the middle of the teeth and into your jawbone. And that works by basically shooting x-rays, which are basically a form of energy, and taking basically images or pictures of your teeth, your bone, and the hard tissue. So a lot of times dental x-rays are taken when we want to see more about what's going on in a specific part of your mouth or in all of your mouth. A lot of times, for example, you might have a toothache or you might have an infection or something bothering you in your mouth, and we can look with our eyes. We can take photos with our in-the-mouth cameras, but sometimes we need to see more. Sometimes we need to see underneath the skin, underneath the gums, and we can't see that with the naked eye. So that's where x-rays come in to play. They let us see things that are underneath, and sometimes the source of the problem can be seen with the dental x-ray that can't be seen with just our eyes. And so that's where dental x-rays are really helpful. So the whole purpose of dental x-rays is just to give you a better, or give us a better sense of what's going on in your mouth. If things are healthy, that's great, we want to see it, and the x-rays will help us to see that. Because like I said, they're allowing us to see things that we can't see with just our eyes, our naked eyes. So they're really helpful in that sense. If there is an infection, or there's cavities, or there's something wrong with the teeth or a certain part of your mouth, sometimes dental x-rays can help us see that and help us to identify the problem. One of the most common types of dental x-rays are just, we call them bite wings and periapicals. Those are just the individual shots that I'm sure you're used to seeing in the dental office. We'll take anywhere from 6 to 20, 25 shots of the different teeth, different parts of your mouth, and you'll be able to see your teeth. You can see the roots of the teeth. You can see the bone in and around those teeth. Those are probably the most common. There's also larger types of dental x-rays. There's panoramic x-rays, which will show like the entire jaw in one shot. We also have cone beam CTs. Those are technically a different kind of x-ray, but those allow us to see and recreate your mouth and your jawbone in 3 dimensions in the computer. And that's another kind of, I guess, not technically x-ray, but a kind of dental image that we use to determine what's going on inside your mouth. Dental x-rays are very safe. Nowadays, with digital sensors and basically everything digital, the amount of energy that's needed to produce a really nice picture or image is much less than what was needed with physical paper film that was used before the development of digital imaging and digital x-rays. So they're very safe. We still will use lead aprons for a lot of the x-rays just to protect you, but the amount of radiation that's produced with the most modern x-ray machines is much lower than it used to be, and so it's very safe for you as the patient. Dental x-rays are really good at showing things that are underneath the bone, underneath the gums that you can't see with your naked eye. It's also really good for seeing things inside the middle of teeth, which obviously you can't really see past the surface of your teeth normally. So x-rays are really good about going deeper, going under, and showing us what's going on underneath the surface, because a lot of times if there is something wrong, if there is an infection or a problem, that will show up in dental x-rays. A lot of times people ask about x-rays showing periodontal or gum disease. And the answer is yes, they can show that, because gum disease is basically when you have an infection underneath your gums and in the bones surrounding the teeth. So a lot of times one of the most common symptoms of that is bone loss. So a loss of the bone structure that's around your teeth. And so when we take x-rays, a lot of times we can show the amount of bone loss, or the fact that there is bone loss in the bone structure that's surrounding the teeth. You'll see it, basically there's less of the bone, or the shape of the bone will be different, and there'll be areas where there's less bone than there should be or used to be in a particular area of your mouth. If dental x-rays are covered by insurance, a lot of times they are. A lot of times that does depend on if you've had dental x-rays before or within a specific time period. So I would say yes. However, you have to keep in mind that sometimes if dental x-rays are taken most recently or within a certain time period, they may not be covered by the insurance. Also, a lot of it depends on the specific insurance that you have. I will say by and large, most insurances do cover x-rays, but it's definitely not 100%. And there are some other pieces of information that we do have to gather in order to make sure that the dental x-rays are covered. Either way, we are going to do our best to get the most accurate and complete information so that you have the information you need in order to make a decision. So if you haven't had a dental exam within 6 months, I would say it's a good idea to get one as soon as possible. If you want to schedule a dental exam with our office, you can definitely do so. Just give us a call or schedule an appointment on our website. I hope I've been able to answer some of your questions about dental x-rays. If you're ready to take action, or if you have any more questions, please give our office a call at 916-285-9678. We're here to help.